we are live. Welcome everyone. I'm just gonna wait for people to hop on, and I'm gonna show you guys some of my goodies in the meantime. There's my Pandia health shirt. I got this super cute tote bag from Dr. Yen. Hello, Nicole. Thank you for joining. And I'm actually gonna show you guys my stickers because I'm very excited about them. Hello, Sophie. This is my Pandia Health Periods optional sticker. It's so cute. I love it. This is my MIT Beaver like spraying disinfectant and Pandia Health. I thought they were so cute, and I love my laptop. But yeah, awesome. Hello, Kenneth. So today, before I get into anything else, I just want to talk about what we're going to be. Oh, thank you. We're going to be talking about endometriosis. So stay tuned if you don't know what endometriosis is, or if you do know what endometriosis is. And I hope that we can learn from each other. I'm a student, rising senior at MIT, studying biological engineering. I'm a pre-med student, very interested in female reproductive health, and that's actually how I got interested in medicine entirely. So I hope, you know, I've been learning through Pandia Health, and I've been doing research in endometriosis. So I have some knowledge, but I'm not an expert, so I hope that we can learn from each other if you guys know more than I do on any of these things. If you're not already signed up, make sure to click the link in our bio to get your birth control delivered for free, and use the code IRIS, or Iris, my name, IRIS, to get $5 off when you sign up for our products. So, endometriosis. If you've heard of it or not, it's a very important disease in the gynecology realm. Okay, so endometriosis, I'm going to explain what it is. It's a disease of the uterus. It's a very painful and debilitating disease, which happens to 2 to 11% of the people who have uteruses in childbearing age. Hello, Jen. Yeah, so so I'm going to explain kind of how menstruation usually works, and then how endometriosis develops, and what treatments are out there, and research generally surrounding endometriosis. So generally, a normal menstruation goes as the lining of your uterus comes out through the cervix and vagina and out into the world. But endometriosis is this kind of unexplained. People don't really know how it happens, which is awesome that we're doing research on it, but we should be nailing it down. So it's when the lining of your uterus, instead of leaving your body as it should in quote-unquote normal ways, it sticks to other organs and causes very painful lesions. And then these lesions kind of react to your hormones the way, hello Yasmin, they react to your hormones in the way that your uterus or your endometrium would normally react. So it grows and shrinks at the time of your period, causing very painful menstruation. So this causes some people to have to miss out on work. It causes nausea in some people, and even in some severe cases, infertility, which is why it's so important to be talking about this, because it does affect 10% of childbearing people. And actually, kind of funny story, I was talking about my research to somebody, and I was like, do you know what endometriosis is? And she says, yes, I have it. And I'm like, cool, which is probably not the greatest way to react to somebody having endometriosis, but I thought, like, scientifically, endometriosis, that it was cool seeing that my research had an impact on somebody, like a real life person that I knew. So yeah, so it's kind of hard to diagnose endometriosis. It's this, I can show pictures, but they're kind of gory, so if you want to just Google it yourself, if you're not faint of heart. It's like little pieces of tissue that stick to your organs. It could stick to your bladder, stick to your colon, stick to the outside of your uterus, stick to your ovaries. I was reading that one of the reasons that it could cause infertility is because it kind of prevents the egg from leaving the ovary, or it kind of prevents it sticks to your fallopian tube in the middle, and it kind of prevents the egg and the sperm from meeting. And again, these are all just theories because we don't really know. The research isn't really out there to justify like what's actually happening, what's the reason for it. So one of the theories about what causes endometriosis is retrograde menstruation. So that would be instead of bleeding all down, some things go up and out of your fallopian tubes and stick to other organs. And but this is very common for a lot of people, and we're not sure when it's dangerous or when it causes endometriosis. So there's a lot of gray areas in endometriosis, which is very frustrating for people who are doing research in it, and for people who have it, knowing that there's such a lack of research out there. So if you've ever heard of Padma Lashik, I think is her name, she actually co-founded the Endometriosis Foundation of America. You guys should check it out. Their website has a lot of information on how, what endometriosis is, what kinds of treatments there are, and research, if you're interested in doing research, how you can get grants for it. Personally, I'm doing research right now, and just because it's hard to study endometriosis on humans, because we don't, a lot of people use mouse models for things, but mice don't really menstruate. It's hard to study endometriosis the way you would study a different disease like cancer. So we are developing in vitro models, so models outside of the body, to test different treatments and try to replicate the endometrium, which is super cool, and I'm so glad that I'm able to do this sort of research. So if you haven't heard of Professor Griffith at MIT, make sure to check her out. Lots of cool research regarding tissue engineering and all that, not just endometrium. Treatments for endometriosis and diagnosis, sadly there's not many, but there's a few, so there's hope. So yes, other animals do menstruate, but sometimes they menstruate once in their life, and they have estrous cycles, which are their estrogen or their hormones fluctuate, but it doesn't cause a bleeding. I've personally never had an animal in my life, so I, from experience, cannot tell you, but I know that dogs bleed maybe once in their life. I'm not sure how many times they do. That's a good thing to look into. But apes are since they're closely related to us, they could be used as animal models, I think, because they do menstruate, but it's kind of hard to keep a bunch of apes around for science purposes, so we just try to recreate it outside and use engineering skills to do that. So the way that you normally diagnose endometriosis is, if you think you have it, you probably do, but the only way to certainly know is to undergo what's called a laparoscopy, which is that they do 3 incisions in your lower abdomen. They stick a camera in, and then they are able to see that there's lesions. Lesions would be the endometrium that's outside of the uterus. There's lesions throughout your cavity, and then they may take it out, they may look at it under a microscope and determine, okay, this is pathological, and then go on from there. Sadly, if it's undiagnosed, if it's really severe, yes, it is very painful. I personally wouldn't know because I don't have it, but apparently it doesn't, how severe it is doesn't correlate to how painful it is. So you may have mild endometriosis and be very in a lot of pain, but you may have super severe endometriosis and not be in any pain, which is interesting. So yeah, it's only diagnosable if you are surgically checked, which is sad. There's also ultrasounds and I think CT scans or MRIs, which could show you a little bit more about what's going on in there. But yeah, so hello. Another sort of so laparoscopies can remove the lesions of the endometrium, which are stuck to other organs or the inside of your body. And then there's the most, the other surgical way of removing it is the most extreme thing you could ever do, is removing your uterus, which is, hopefully we'll get to a point where that's not the case. There's a lot of different treatments to be considered before you get there, but sadly, endometriosis does result in some people losing their uteruses because of them. So actually there's some hormone treatments which I have to pull up because I don't know them. And they are, for example, like progestin pills, which are progesterones, which could stop your periods altogether. Pandia Health, we love periods optional. I love periods optional. I love not having to bleed, which is great. And if you don't have to bleed, you don't have to go through these painful cyclic, I guess, lesion pains that come with endometriosis. But it may not be so easy to get rid of your period if you have endometriosis. There's other hormonal ways to treat it, or that people treat it. There's a way to kind of induce menopause, which is not hello. Some, like if you're a 22-year-old like me, actually I'm 21, I always forget. If you're 21, you've never had children, you plan on having children, you kind of don't want to, to go to have a menopause at this age. So that, that's always the last resort, and it's given to people who have already had children, don't want children, or just, in a lot of pain, their life is being sacrificed by this. I was able to shadow a doctor who treats endometriosis patients, and it's so painful that she couldn't even do a pelvic exam on her, because it was very painful just to insert anything into her vagina because of her lesions. And it's seeing how debilitating that is and not feeling it myself, not knowing what that was. It just makes you wonder why there's not that much research being done on it. So thankfully there are people doing research out there, but not that many. So I'm gonna look up the other hormonal therapy that I cannot find right now. I'm looking right now at the Hopkins Medicine website, which has a great endometriosis section. Okay, cool. So progestins alone or oral contraceptives, like I mentioned, making your periods optional really helps. It reduces the flow, prevents ovulation. If you don't want to have kids, great option. Once you do want to have kids, hopefully this will decrease. There's no research that I'm aware of to say that this taking oral contraceptives when you have endometriosis reduces the risk of infertility. But from what I've learned, it seems like it makes sense that it would reduce your endometriosis throughout. And then there's a danazol, which is a synthetic derivative of testosterone, which is another hormonal therapy that people use. So there's 4. So oral contraceptives, progestin alone, which is progesterone, the pregnancy hormone, the drug that induces early menopause, and then the synthetic testosterone, which all work to try to relieve the symptoms, maybe trick your body into thinking you're pregnant, kind of like how periods optional works, or how oral contraceptives in general work. And then ultimately, after all that has been tried, laparoscopy to remove the lesions, or hysterectomy to remove the uterus if you feel comfortable doing so. I don't think any doctors are pushing that on people with uteruses. When I was shadowing a doctor, she was like the person had to say, I absolutely do not want to have my period, or I absolutely do not want to have children in order to get your uterus removed. So it's not like they're going to come in and try to take your uterus from you. Hello. But yeah, if you guys have any questions regarding anything I said, let me know. I think that was all I had to say. Make sure to check out the Endometrium Foundation of America website if you're interested in learning more about endometriosis. If you think you have it, it goes undiagnosed for a lot of people for around 10 years. So people miss school because of it, people miss important parts of their life because of it, and it just reduces the quality of life and your income, and yeah, it's totally unfair. 1 in 10 people with uteruses have it, so it's out there. I'm glad you guys tuned in to learn more about it. I hope that you can support a friend who has endometriosis, and make sure to check out our YouTube and our blogs. We have a few blogs talking about endometriosis, and I talk about breakthrough bleeding and how to stop your period. Thank you, Nicole. I'm glad you learned. Thank you guys for tuning in. Use my code EDSirIris I'll catch you guys next Monday. Yeah, have a nice day.